Assessing and understanding the radial pulse is a fundamental clinical skill. It appears deceptively simple and is usually brushed over quickly in medical school. But please pay close attention to the following details to make sure your exam technique is absolutely bomb-proof. The radial artery is palpated by placing one finger across the anterior aspect of your patient's wrist, specifically on the radial, lateral, or thumb side. The anatomical landmarks are the brachioradialis tendon laterally and the tendon of flexor carpi radialis medially. The space, and sometimes slight indentation in between, is where you will find the radial artery. The technique for feeling the pulse is to slightly compress the artery against the distal radius bone. But then the fun begins. With the artificial time constraints of an OSCE, there are only two characteristics of a peripheral arterial pulse you need to comment on. Firstly, the rate. Count the number of beats in 15 seconds and multiply by 4 to give the beats per minute. And secondly, the rhythm. Determine whether the pulse is regular, in other words, normal sinus rhythm, or irregular. And what you're really looking for is atrial fibrillation. Then confidently state both the rate and rhythm. For example, radial pulse is 72 beats per minute and is regular in character. As an additional time saver, and to avoid the uncomfortableness of staring at someone's chest for 15 seconds, you could count the respiratory rate immediately after you have determined the rhythm, and while still with your finger on the pulse. And then you can add that vital sign to your commentary. For example, radial pulse is 72 beats per minute within normal range, is regular in character, also normal, and the respiratory rate is 12 breaths per minute, also within normal range. And that's it. Do not at this early stage of the examination try to read too much into the character of the radial pulse. Leave that to the carotid artery. And certainly do not, unless the patient is clearly in respiratory distress, which is very unlikely in a woke OSCE, add a value judgment to any perceived abnormal breathing pattern. Problem number 1. Unable to feel the pulse? All you feel is your own racing pulse, possibly up to 180 at this time of the exam. This is the solution. Make sure you are not pressing too hard, which is quite understandable in an exam situation, which may completely occlude the pulse. So back off and feel gently, but not too gently, or the opposite will occur. You need to feel as many pulses as you can prior to taking these type of exams. Solution 1B. Check that there are no longitudinal scars over the course of the radial artery, suggesting a previous coronary artery bypassed graft or harvesting. Try the opposite wrist. Still unable to feel a pulse? Check the colour and temperature of the fingers and perform capillary return. If normal, then simply state, I know the anatomical landmarks, I'm in the right place, but unable to palpate the pulse to assess its rate and rhythm. However, it appears that the arterial supply to the hand and fingers is intact, and we'll come back to this at the end of my examination. By that time, hopefully your own pulse will have calmed down and you will be able to feel the pulse. Problem 2. Trying too hard to impress by stating unnecessary and unreliable value judgments like weak thready pulse, or dramatically lifting up your patient's wrist, trying to elicit a collapsing pulse or water hammer sign. The solution? Leave this type of showmanship and time wasting to later in the examination when you have actual hard evidence of a reduced cardiac output or of aortic incompetence. You can always come back to impress examiners with such knowledge. Unfortunately, the woke state of most medical schools does not allow marks for this type of stuff. Passive box-ticking examiners are given very little or virtually no options, and because of the inherent structure of making sure there is an even playing field, it is most unlikely you'll ever see such a patient in an OSCE environment. And if you did, it would be by accident. And I can assure you, there will be no box for an examiner to tick for such extravagance on your part. Leave these type of theatrics until after you graduate.